Hi everybody, I'm really delighted to welcome everyone to the webinar today and thank you for taking the time to join us. This is the second webinar that we've held and we had a lot of people who joined last week and a lot of good feedback about how useful it was. I hope that it's an opportunity for us to update people on current issues and also for you to raise any questions that you have. You can submit questions now using that little Q&A icon that you've got on your screen, and we will get through as many as we can. If we don't get to your question, or if I don't know the answer, which is possible, then I promise you we will put the answers on the internet, so there'll be that list of questions that you've raised and full answers where I wasn't able to provide that. And we will email a video of today's webinar out to colleagues, so anyone that can't join live will still be able to see it later. Now, before we open up to questions, I will give you a little bit of an update, but before we go into operational issues, it's really important that I start by acknowledging the very sad death of Andy Costa. I know that you will have seen the information that we put round, recognising the huge contribution that he made to our services and the enormous loss that he is to us as this family that we have in Camden Islington. I'm really distressed, and I know many of the ward staff that worked with him are feeling his loss very acutely, and we think about them as well, of course, as his family. So we will be having a 2-minute silence today to remember Andy. So I would ask you, if possible, to try and join that, either just quietly where you are, or if it's appropriate, socially distancing, to step out and to be with colleagues. And I know that those people working on Pearl and Garnet wards, where Andy was administrator, will be grateful for that support as well. Now, moving on, that gives me the chance to just thank everybody again, as I did last week and as we continue to do. I'm incredibly grateful. I know the board is just all the time recognising the huge sacrifices that you are all making to keep working, to keep providing support to our service users, and to be flexible and really giving the extra bit. I know everyone's doing that, so thank you so much for all that you're doing, for the difficult journeys that you put up with, for the redeployment that we ask some of you to do to work in different places, and for obviously those very long hours. I would ask you please to look after yourselves as much as you can. It's really important. The wellbeing offer is well publicised on the internet, and we remind you about it when we can in our daily communications. Beth Flint and her team are there, are offering all sorts of support for your mental health, but don't forget your physical health as well. So as we've said before, when you need a break, when you're really feeling tired, you must be able to say so. And please do look after yourself and eat well and sleep well. It's terribly important that you take care of you and your colleagues. There's a couple of issues that I know have been raised by questions that came through prior to this webinar. There's a couple of things that are live issues anyway, so I'm going to wrap all of those together and I'll talk about a few of them, and then I'm going to hand over to Jackie, who's going to pick up on a few of them as well. So I wanted to start by just saying something about PPE. It's obviously hugely covered by the media. There are regular conversations wherever we're listening or watching the news about PPE. So let me just take this opportunity to reassure everybody that we are getting good supplies of PPE. So please don't worry that there's any scarcity of resource. You can access the supplies that you need. And I think we have given very clear guidance to people, so people know the situations where they should be using different levels of PPE. There's a really helpful little picture actually that's been produced nationally by the mental health community that, if it hasn't come out to you yet, will be coming out very soon. That will make that even simpler as a bit of guidance. But above and beyond that, as we have always said to you, it is for you to risk assess the situation that you are in, and if you feel that you need to use PPE or a slightly higher level of PPE than perhaps might usually be suggested, that is for you to judge. And as I said, those goggles, those eye shields are in good supply now, so please don't worry about that. The second thing that's been raised, and again there's been a huge amount about this in the media, is about testing. So let me just say a little bit about that, but we will put more details on the FAQs on the intranet. So first of all, we are obviously accessing very easily tests for our service user community where there are symptoms being displayed that lead us to think that they may have a coronavirus, and we're getting very easy access to those tests now, I'm pleased to say. Secondly, in terms of staff, you'll know that it took quite a long while to get the testing capacity up. That is now coming on stream. We're getting more slots made available to us every day. We have testing both drive-through and walk-through at the Whittington. We also have testing that is soon to come online with the British Library opening up some car parking space there so that we can use the crick. And we are hoping that possibly next week, but certainly soon, there will be postal testing services available. We haven't got them yet, but they are certainly being planned and should be coming online. Now, obviously, for the testing at the Whittington, for example, you do need to be referred by your manager, so do please use that route. The rules around testing really are that whilst you don't have to have a test before you come back to work, if you're living with somebody who's got symptoms and you need to self-isolate, which is the guidance, then obviously we are encouraging people to get tested so that we know whether or not you have been infected and when you can come safely back to work. So we are prioritising frontline staff for testing, either those staff who are symptomatic, so that we do know, if you haven't got COVID, then we know as soon as you're feeling better, you can come back. But also, as I said, those people who are self-isolating because they're living with somebody who is positive. We are working with providers, as I said, to extend it more broadly so that we'll be able to get more and more people tested. So do please keep watching the internet and keep talking to your managers so that you will be the first to know when we get more and more testing slots. I mentioned in my introductions, probably the last thing from me, that I'm grateful for people being flexible in the way that they work, and that has sometimes meant, is often meaning that we're asking people to work in a different team, cover a different geographical patch, or indeed work in a completely different area to where they normally work. I really appreciate that for some people that can feel quite anxious to be asked to work somewhere you're not used to working. So we're doing everything we can to make that feel comfortable. And if you are asked to work somewhere different because we really need the help, and you feel anxious about it, then please don't hold back, say so, and say what support you need to be able to make that feel better. We are obviously offering training for people who are working with a different patient group to usual. We are offering buddying up so that people don't feel that they're kind of left on their own. And we can do more. So if there's something more that you need, please do say so. But you will understand that we have to prioritise our most acutely unwell patients and those core services that enable us to keep people safe. And when our staffing levels dip in those areas, there is really nothing else we can do but come out and ask others who would normally work in a different setting to please be flexible and help us fill some of those shifts until our staffing starts to come back, obviously on a temporary basis. So I think I'll stop for a moment and hand over to Jackie and ask Jackie just to cover a couple of other issues that have come up.
Great, thanks very much, Angela. So one of the questions that's been posed is there any news on the antibody test being made available to staff? Obviously, there's lots of speculation about this test and when it will be available. But it isn't at the moment, and as and when it is, I'm sure we'll hear from the Centre, from the Department of Health and others about when we can make use of it, but at the moment it's currently not available. Another really interesting question is, can you get the virus twice? For those of you who do watch the news, and if you're like me, you try and limit how much news you watch each day on this. But there has been some speculation, particularly in South Korea, that some individuals have got the test twice. The current understanding is that you can't get it twice, but there's not enough evidence at the moment to answer that question. But it's a really good one, and I think everyone will be interested to know how this develops. And then you're asking, do we think we'll make any permanent changes to services as a result of this? Well, I, for one, as chair of the board, and Angela and colleagues, know that we've all had to make some really significant changes to the way in which we work. And you'll know even at home that you have to do this. I'm not sure how many of you are using House Party or Zoom or Skype, but certainly in the workplace we're using Microsoft Teams. We had our first board meeting at the end of March using Microsoft Teams. That was very interesting, but we're all having to think about how we do things smarter, quicker, more flexibly, so that we don't add burdens to staff, and particularly the executive team. So I'm hoping that out of this we get some really positive ways of doing things differently in the future, because we do need to think about this positively, and I hope that's going to be one of the lasting legacies from this virus. So that's the questions that we've got so far, but I think we might have some others that we need to focus on.
So great that you're sending in your questions. So we've had 2 or 3 already, and the first one actually is a bit of an extension to the things that Jackie's just said. So somebody's asked if social distancing is taking place in the offices and the other non-clinical areas, and the short answer is yes, but I'll elaborate just a little bit. We are very faithfully following the social distancing, to the extent that we are not having executive meetings where we all gather in a room. We're all sitting in our individual offices, those of us that are in, some of us of course are working from home, and we are virtually meeting. And certainly on this floor, and I know on other floors when I've walked around, people are staying in their own space, making sure that there's always those 2 meters between them, and we're being very careful to really adhere to that. So I can assure you that we're doing that as per the guidance. Somebody has raised quite a different question. Someone's saying that they've heard that we're going to be getting uniforms on the wards and asking when that's going to happen. There was a request put through from staff working on the wards asking for uniforms. I think we agreed, of course, if that was something that people felt would be helpful. We then hit supply chain issues, so apologies that you didn't get them the next day, but I was told that that they would be arriving tomorrow at the latest, so you should have those available very soon. Somebody has asked about the meals and whether the meal offer is going to change, and someone has said it would be good to get more variety. I don't have a lot of information on this, but what I would say is that I have had feedback that people like the snack packs and have been grateful for those. So those will continue. If you would like more variety and you'd like to be a bit more specific about that, please drop a line to comms and give us some feedback, and let's look at that and see what we can do. I do know that there are some food suppliers outside, so some of the cafes or restaurants that have very kindly offered to make food available, and we are progressing how we can do that in a way that does give people a bit more variety, sometimes something hot, for example, but also it doesn't mean that we all get inundated with too much food one day and then nothing again for the rest of the week. So we're just looking at how we can safely do that and enable you to book food from other suppliers that can then be brought in. But if there's any update on that, I have a feeling that there was an additional supplier yesterday. Then what we'll do is we'll put that on the FAQs so that you've got the absolute up-to-date information. There's another question here. This is quite an interesting question. It's asking me to look at the crystal ball. Somebody's asking whether we expect another major outbreak next year or this autumn, and whether we are preparing for that. Now, I'm sure that you appreciate there is loads and loads of work being done, largely, I believe, led by Imperial, but lots of work being done looking at the data that we have, looking at the cases, looking at the kind of the modelling information from the community population, as well as the information that we have about the activity that's going on in hospitals in the NHS. At the moment, what we can see is cautiously that it looks as if our cases are flattening a little bit. I'm sure you've heard that on the news, but we were being told that in confidence a few days ago. So we have to wait and see if that continues. Obviously, it's very early days, and my understanding is that we probably need another week before we'll be really confident that that's the trajectory we're on, a kind of a flatter curve that might go out a bit further, so it might take a bit longer to come down. And I understand that the modelling indicates that that might mean, and I must stress the might, because I think there's still a huge amount of information and understanding that's being gathered about COVID-19. But there is a possibility that, that there would be a further spike in the autumn. But I'm afraid I don't know any more than that. All I know is that the Imperial epidemiologists are working very hard to understand that. In terms of planning, we are definitely planning a number of scenarios across London and certainly nationally as well. And very much that is, one of the scenarios might be that we come through this outbreak and that then there is a further outbreak at some stage later. Clearly that will continue to be informed by the data, but we will be able to plan, I think, very effectively, partly on the basis of what's worked in managing this outbreak, and we'll be able to deploy and sort of rapidly activate some of those things that this time we've done and we found really effective. I think the second thing to say is that I think we would all hope that if there was a second outbreak later in the year or indeed next year, that we will probably have better treatments as well. And you've probably heard, as I have, that, and I know because we've been asked to put forward people for some of the trials, there's all sorts of trials going on with treatments at the moment. And I think it would be reasonable to assume that some of those would be having some good outcomes by the autumn, and therefore we might be able to provide much better treatment for people who'd otherwise be quite acutely unwell. Somebody's asked something about laptops and iPads and whether we've got enough. I'm not going to stick my neck out and answer yes to that question in case I'm wrong, but we will check. What I do know is that we've had huge increased deliveries, I mean massive deliveries that I keep seeing coming through on my email or my WhatsApp. So I do know that according to what people are saying that they need, we've got more and more. We particularly tried to get more for the wards so that people have got things to do, but we've also got more, obviously, for people working at home and for people working in the community. So I will get the up-to-date position in terms of whether there's still some people who are waiting and whether that's awaiting another delivery or whether it's just waiting. I do know we had a delivery earlier this week that then had to be prepared, ready to go out. So I would hope that we are near to meeting the need, but we will ask that question accurately so that I'm not giving some mistruth. But if you are in a team where you do need some technology that we don't have, then just drop us a line and make sure that we have got that in the numbers. And this is one for Jackie, so I'll hand that over to Jackie.
Okay, the question I'm being asked here is how are we keeping in touch with our governors and other external partners? Well, I do a weekly vlog for governors, so every Friday morning I record on my video on the iPad the events of the last 7 days, so I keep them up to date with all the information that Angela keeps me up to date with, how our services are affected, how our staff are affected, how service users are affected by the virus. And the sorts of decisions that the team need to make. So I do that every week. That goes to the governors. I also have a weekly conversation with the lead governor, Wendy Savage, and I'm in touch with her and David Barry fairly regularly just to keep them in the loop, because I think it's really important that the governors not only understand the pressure that we're under, but can also offer their support at this really difficult time. And that's the same with external partners. Angela is on a call probably 2 or 3 times a day with our external partners in North Central London, local authorities, STP, just getting information about how other services are being affected and how we can support them. And in that context as well, BEH, as you know, we have an alliance with them. And Angela was talking just the other day about mutual aid between the 2 organisations. So the external contact is not diminishing in any way. As I say, I think it's really important that we keep in touch with our governors. And then there's another question for me. Have you been getting any feedback from staff and service users generally on how people are feeling? Well, Angela tells me all the time how people are feeling, but if you wanted to email me particularly, then please do so. And again, I think through the service user groups that we have, we're getting information on how staff are feeling and service users are feeling. It's really important that we know how you feel. I see the daily communications that go out, they're always at the top, asking you to say how you're feeling and the support services that are available, and I think that's terribly important. But do, if you want to email me with any particular issues, I'm happy to look at those and obviously talk to Angela and the team about that. Thank you for that question.
Okay, a couple from me now. Somebody has shared here that they previously redeployed some staff onto the wards and they felt that they didn't get quite the level of training or induction that they would have wanted, and they're asking what they should do if that happens again. I'm really sorry if that was somebody's experience, really sorry, and it's really helpful feedback, so thank you for telling us that. I think for anyone who is redeploying, it's really important that you say what sort of training that you think you need. We are offering training, as I said, we're offering buddying as well, and quite a lot of support, but it's important that we learn, and so if we're not quite covering the needs that you have, then please tell us. That's what I would say. If the same happens again, if you're being asked to go into a ward and that's not been your most recent experience, and you go through the training and think, I'm still not feeling really confident, then just speak up. But it might also be worth, if you've got some experience from the past, just dropping a line to Dean Howells, to our Director of Nursing, and perhaps giving him some more detailed feedback about what sort of training or what information wasn't in the training that you would have wanted to have, so that we can really make sure that we are providing what's needed for next time. So I am genuinely sorry, but please do give us the feedback. Somebody has asked here whether we have enough volunteers. I'm not the person to know the answer to that question. What I do know is that we welcome volunteers enormously, and there's a huge amount of course that people can do, even if it's just ringing up some of our service users who would typically be coming in perhaps to a sort of a social group, a support group, and aren't able to do so at the moment. Just checking in with them, and there are many other things that people can do while still looking after themselves and staying safe, keeping their social distance. If people know of someone who would want to volunteer, then please tell them to get in touch with Joe Scott. We can put Joe's contact details, I'm sure, somewhere on this FAQ or on the intranet. So yeah, please do get in touch. Now, somebody has said here that they've been working at home for some weeks and they still don't quite have the equipment that they need, despite chasing. I suggest that you do a nice email to Jeff Botan, and you'll be thrilled that I've named him on this webinar, absolutely delighted. But drop him a line, tell him what it is that you need. Somebody got in touch with me recently about something. I have to say, I passed it to Jeff and he fixed it. Just like that. So Jeff, I'm counting on you to sort it out. Probably coming towards the end. Somebody's asking whether we should be wearing masks on the tube to protect the public. It's a really good question. And that's about whether because we're coming in contact obviously with our service users, whether we would be protecting other people if we wore masks. There's been lots of talk about this, hasn't there, in the media again, about the benefit or not that masks might play. And as you probably know, there's some thinking that suggests that masks don't protect you as an individual from other people, but if you are infected, actually they do protect other people from your droplets, so to speak. I haven't yet heard guidance that NHS staff should be all wearing masks on their commutes, or indeed when they're in the supermarket or anything else. So I would say that the answer at the moment is no, not yet. but we will keep close to that, and if I'm told after this that I've given the wrong advice, or if that's changed, then I promise we will let you know. But I haven't heard that that's the case yet. I think probably it's a matter of being very mindful of the guidance if you become symptomatic about how you make sure that you are staying at home and looking after yourself. And the last nice techie question for me to try and manage is, when is Office 365 going to be launched? And I don't have the date, so I certainly know that it is soon. And I will again go to my friend Jeff and ask him to put a slightly more specific answer. But obviously, as you probably appreciate, because of all the demand that there's been for remote working, some of the work that needed to be done to get ready for Office 365 has been a little bit delayed. But I do know that it is imminent, so I will get Jeff to give the absolute message about when we can expect it. And I think probably for me that's all, other than to reiterate again my genuine thanks to everybody, and thanks for the kind of good spirits as well. I see people in the corridor, on reception, and in the cafe, and everybody's smiling, and we're all trying to keep each other bright. Thank you so much for everything that you're doing. Please don't think for a minute that it is in any way not valued. We hugely recognise what you're doing, and we know how much we rely upon you. So tell us if there's more that we can do to make it work well for you. And I'll hand over to Jackie.
Thank you. Yeah, just a few final words from me, if I may. Angela used a word at the beginning of this, and that's sacrifice. And I can't think of a better way of describing the sacrifices that you're all making day in and day out to support our communities and each other. I am in complete awe of what you do, and I'm so grateful. And when I stand outside my house on a Thursday evening clapping my hands, I think of everyone here doing their absolute best to keep people alive, keep people safe, keep our services going. So a big heartfelt thanks from me on behalf of the whole board to Angela, the team, every single member of staff for what you are doing day in and day out, every minute of the day. It is truly appreciated, and I thank you very much.
Thank you.